Good day. Okay, yes, let's take a look at your Clonorchis sinensis. Still, this one is under your trematodes. Okay, and so yes, your Clonorchis sinensis, this one is otherwise known as or commonly known as your Chinese liver fluke or your Oriental liver fluke. Okay, and so as the habitat of your Clonorchis sinensis is the bile duct and your gallbladder. Okay, the first intermediate host of your Clonorchis sinensis is still snail. Okay, and so please don't forget that for your trematodes, the first intermediate host is almost always a snail. Okay, as for the first intermediate host, you have the following under the under the genera Paraphosarulus, you have the following. Okay, and yes. Okay, and so there's snails. Please note that there are more than 100 species of snails that can serve as an intermediate host for Clonorchis sinensis. Okay, and also this is snails, this intermediate host of your Clonorchis sinensis. These snails generally live in ponds that are used for commercial fish raising, lakes, and slow moving water. Okay, and so for this one, and yes, with that slow moving water, overall infection rate is relatively low accordingly. Okay, and so second intermediate host of your Clonorchis sinensis, you have your fish or your fresh water fish. Okay, the final host is humans, or the definitive host are humans. As for the reservoir host, you have your dogs, your cats, your pigs, rats, and other fish eating mammals accordingly. The infective stage is the metacercaria, and then the mode of transmission is uh, ingestion of freshwater fish that possess your second intermediate, I mean, ingestion of your freshwater fish that possess your metacercaria. Okay, and so yes, ingestion of raw or pickled or salted fresh water fish that possess your metacercaria. Okay, yes, let's move on to your developmental stages. As for your ova or your egg, please note that the ova is the ova of your Clonorchis sinensis is embryonated when laid accordingly. Okay, and so yes, it is the ova of your Clonorchis sinensis is operculated and it is mature when laid. It is 30 micrometers by 15 micrometers in size, and it is yellowish brown with distinct convex operculum. Okay, and yes, accordingly, it resembles an old-fashioned electric bulb. Okay, and so for your Clonorchis sinensis, again, it resembles the ova of your Clonorchis sinensis resembles an old-fashioned electric bulb, or you have a pitcher-like appearance. Okay, and so a pitcher-like appearance. Okay, and so also of there is a thick rim that is located around the operculum, and that is referred to as the shoulders. Okay, again, there is a thick rim that is located around the operculum, and that thick rim is referred to as the shoulders. Okay, and so that is for your Clonorchis sinensis ova. Okay, and so yes, this one is an illustration of your Clonorchis sinensis ova. Okay, and so there is a thick rim here. This one is called as your shoulder. Okay, and so yes, oval still the ova, and yes, please note that inside this one is your miracidium. Again, a your the ova of your Clonorchis sinensis is mature when laid. Okay, and so yes, this is your operculum. Okay, and so you have your miracidium, your developed miracidium, and then a small knob present. Okay, and so 30 micrometers by 15 micrometers accordingly. Okay, and so yes, let's take a look at this. You have somewhat in this image the shoulder, or yes, this thick rim that is referred to as the shoulder is somewhat visible. Okay, and so you have here the operculum. Okay, and yes, it is brown in color accordingly. Okay, and so it is brown in color, yes, somewhat. Okay, and so the small knob is not appreciated in this image. Okay, also, this is another illustration of your Clonorchis sinensis. Again, the ova or the eggs of your Clonorchis sinensis are ovoid. Okay, and so with a, yes, they have a thick brownish yellow shell. Again, they have this operculum. Okay, and so they have operculum. Okay, and then yes, somewhat in this image. Okay, and so the shoulder. Okay, and so the opercular shoulders are somewhat distinguishable. Okay, and so for this one, again, inside this one is your mericidium, because again, the ova of your Clonorchis sinensis, they are mature when laid. Okay, and so they are mature when laid. Okay, that is for your Clonorchis sinensis ova. And yes, they resemble an old-fashioned electric bulb or picture-like appearance somewhat. Okay, and so yes, moving on to your cercaria. Please note that the cercaria of your Clonorchis sinensis has spots accordingly. They have spots. Okay, and yes, the adult Clonorchis sinensis measures 2 by 0.5 centimeters, and they are flat, transparent, elongated, round, and they are rounded posteriorly, and they are attenuated anteriorly. And yes, they have a smooth and shiny cuticle. Your ventral sucker is smaller than the oral sucker, and the testis is branched, which are arranged in tandem. Okay, yes, each end portion of the adult worm is narrower than the mid portion of the body. Okay, and so the posterior and the anterior portions are narrower than the mid portion. Okay, yes, let's take a look at this one. So what we said earlier, the posterior, sorry, the posterior and the anterior, they are narrower than the mid portion of the body. Again, yes, again, they are flat, lance lance shape somewhat. Okay, and again, okay, and so 2.2 by 0.5 centimeters, or yes, okay, and so yes, this one actually, this image here is an illustration, actual illustration of the worm. Okay, yes, and yes, okay, moving on. You have here your another illustration, a stained, carmine stained Clonorchis sinensis adult. Okay, you can see actually, of course, this is your oral sucker. You have the ventral sucker. You have here uh your esophagus, which bifurcates into your ceca. Okay. And then, yes, you have the uterus. The uterus is located in the anterior portion, and the testes is located in the posterior portion. Okay, and so you have, of course, again, your ventral sucker, which is otherwise known as acetabulum. And then you have your oral sucker. Okay, and so for this one, you have the pharynx and then the esophagus, which is wherein the esophagus will bifurcate. And yes, you have your vitellaria present here. Okay, this one is an illustration of your most common snail host of your Clonorchis sinensis. This one is present in Southeast Asia. Okay, as for the life cycle of your Clonarchis sinensis, your adult resides in the biliary duct. Okay, your adult resides in the biliary duct. The adult worms, of course, deposit eggs in the bile ducts, and the eggs are discharged with the bile fluid into the feces and then passed out into the environment. Again, as what we said earlier, the ova of your Clonorchis sinensis, they are embryonated when laid or mature when laid. Embryonated eggs are passed to the intestines, then to the feces. Of course, the ova are ingested by the first intermediate host. Please note again that there is no embryonisation that will take place outside the environment in your Clonorchis sinensis. The eggs are ingested by the first intermediate host, or the embryonated ova are ingested by the first intermediate host, which are your snails, of course, and inside your snail or inside your first intermediate host, your eggs release the miracidium, which develops into sporocyst. Then the sporocyst will develop into rhedia. Then the rhedia will develop into cercaria. What will happen to your cercaria here? The cercaria will move, okay, or it is released, or it will move outside of the snail. It is released, cercaria are released from the snail, and after a short period of swimming, the cercaria will find your freshwater fish, the second intermediate host, which then it will penetrate. The cercaria will penetrate the tissue of your freshwater fish, the second intermediate host, and then the cercaria will insist into metacercaria. The cercaria will insist into metacercaria. Okay, your cercaria will insist into metacercaria. And yes, of course, after the catch, your fish is caught. Okay, so during fishing, then the fish is ingested by man. Okay, the fish is ingested by man. Okay, and so please note that infection of humans occurs by ingestion of undercooked, please note, or raw, undercooked, raw, or salted. Okay, salted or pickled or smoked fresh water fish. Okay, again, infection of humans occurs by ingestion of undercooked, salted, or pickled or smoked fresh water fish. Okay, what will happen to the metacercaria once ingested by humans? It will exist in the duodenum and then will ascend to the biliary tract. Then it matures. Okay, it will ascend via the ampulla of Vater and then mature, of course, in the biliary tract. Okay, again, they reside in small and medium-sized biliary ducts accordingly. That is for your Clonorchis sinensis. Please note that maturation of your Clonorchis sinensis adult takes approximately 1 month, and the life cycle takes approximately 3 months to complete in humans. Okay, maturation to adult takes approximately 1 month, and the life cycle takes approximately 3 months to complete in humans. That will start, of course, from the time that the ova is ingested by your snails. Okay, 3 months from the time that is ingested by snails to the maturation in adult. I mean, to the adult inside the small intestine or inside the biliary tract, it will take approximately 3 months. Okay. Again, this one is an illustration of the life cycle of your Clonorchis sinensis. Your adult Clonorchis sinensis resides in the biliary ducts or biliary tract of your definitive host, of your final host os, the humans. Eggs are passed in the feces, and then the eggs are ingested by the snail, which is the first intermediate host. Then inside the snail, you have here the development of uh, the mericidium to sporosis, to rhedia, and then to cercaria. Okay, and then the cercaria will move outside of the snail and then swims freely in water, and then it will find your freshwater fish. It will penetrate the freshwater fish, and then the cercaria will insist, okay, in the tissues of your freshwater fish. And yes, the freshwater fish is eaten by humans. It is eaten raw, undercooked, pickled, or salted or smoked fish. Okay, this one is an illustration of your life cycle of your liver and lung nematodes. Okay, and so for your lung, of course, you have the Paragonimus manai. Okay, and so humans present inside your humans are adult worms, and then eggs are passed in the feces, hatch to larva, and then you have the developmental stages in the snail. Cercaria will emerge and then swim and then finds your second intermediate host, wherein the Cercaria will insist, and then the the freshwater fish containing the metacercaria is ingested by humans. Okay. As for the pathology and symptoms, please note the disease caused here is clonorchiasis. Okay, your Clonorchis sinensis was described first. This was first described by McConnell. McConnell. Okay, again, the adult worms of Clonorchis sinensis was first described by McConnell. Okay, also the pathologic changes was seen in a Chinese patient who died in Calcutta, India. Okay. Accordingly, uh, your Clonorchis sinensis or Clonorchis sinensis infection is relatively it is asymptomatic in light infections. Okay, and complications of Clonorchiasis are actually the result of biliary tract obstruction or biliary obstruction accordingly. Okay, accordingly, inflammation and intermittent obstruction of the biliary ducts will cause irritation of the bile ducts. Okay, yes, and please note that there are lesions confined mainly to the biliary tract system, and these lesions, okay, these are a result of mechanical irritation and toxins that are produced by Clonorchis sinensis adults. Okay, again, in heavy infections, you have their heavy infections of your Clonorchis sinensis will cause thickening and localized dilatations of the bile ducts with hyperplasia of the mucinous glands. Okay. Uh, yes, in early infections, you have leukocytosis and eosinophilia. In acute infection, you have enlargement and tenderness of the liver, abdominal pain, nausea, diarrhea, and eosinophilia accordingly. Chronic infections, you have their cholangitis, cholelithiasis, the pancreatitis, and cholangiocarcinoma. Okay, and so yes, let's define cholangiocarcinoma later. Okay, in case again of heavy infections, okay, presence of worms will cause hyperplasia accordingly, and the worms will also will obstruct the biliary tract that will cause bile retention or retention of bile. Okay, and yes, as a result, also infiltration of lymphocytes and eosinophils, and of course, leading to fibrosis. Okay, that is for your what you call this Clonorchis sinensis. And yes, as what we said earlier, acute pancreatitis, cholecystitis, and cholelithiasis may be the result of worm because again, okay, and so there is a blockage. The bile cannot move outside. It cannot flow freely. There is a stagnant. The bile is stagnant. It will actually favor your your cholelithiasis. Okay. In case of your cholangiocarcinoma is a malignant tumor that arises from the bile duct epithelium. Okay. And yes, this one is the second most prevalent liver cancer after hepatocellular carcinoma accordingly. And yes, cholangiocarcinoma is associated with Clonorchis sinensis, but then there is no direct link. Okay, there is no direct link between clonorchiasis and carcinoma and this cholangiocarcinoma. But then please note that the first step in malignant transformation is induced by the biliary tract, or maybe the first step in malignant transformation may be induced by the biliary tract hyperplasia that is caused by the presence of a lot of worms in the biliary tract. Okay, and so for this one. Yes, that is for your pathology and symptoms of your Clonorchis sinensis. Okay, as for the laboratory, please note that ova can be detected, or ova can be detected in the stool. And yes, you make use of sedimentation concentration technique, because zinc sulfate flotation technique is not effective, because again your eggs of your Clonorchis sinensis, they have operculum, which makes it heavy. That is why it will not float. Again, sedimentation concentration technique is recommended in Clonorchis sinensis recovery of your ova. Okay, eggs in the biliary drainage, you can make use of Intero test for this one. And please note that the eggs of your Clonorchis are practically indistinguishable from those of Opistorchis accordingly. Aside from your eggs, okay, and so there is an elevated IgE levels in the serum of infected individuals. Also, in acute infections with Clonorchis sinensis, there is an increase in IgM levels in serum, followed by an increase in IgA and IgG levels. Okay, and so aside from those, you have immunologic test and liver scan accordingly. Okay, and so for this one. Again, you can make use of Intero test or duodenal aspirate. Okay, and so to recover uh, eggs in the bile fluid. Okay, and so adult worms can be utilized, can be recovered in case of treatment. Okay. But then please note that in case of biliary obstruction, the eggs of your Clonorchis sinensis are not found in the stool. In case again of biliary tract obstruction, because again your Clonorchis sinensis adult, they are capable of blocking, okay, your biliary tract. Okay, that is why your eggs are not found in the stool in case of biliary obstruction. What is the remedy? You do your needle aspiration surgery or autopsy specimens. Or again, okay, and so autopsy, sorry. Okay, and so for that one. And yes, laboratory, as for the diagnosis, okay, you can make use of, individuals accordingly who have lived in areas where infections are endemic and have a history of eating raw fish and have symptoms of your upper abdominal pain, indigestion, diarrhea, and hepatomegaly may uh they are suspected of having liver trematode infection. Okay, and so for that one. Okay, as for the treatment, praziquantel, that's still the drug of choice, albendazole, chloroquine, phosphate. Accordingly, these are uh, the drugs utilized, or yes, the drugs that are utilized in clonorchiasis. Okay, prevention and control, thorough cooking of fish. Okay, thorough cooking of fish, because as what we said earlier, the mode of transmission is eating an infected fish, eating a freshwater fish that contains the metacercaria. Okay, eating a raw freshwater fish, undercooked or raw freshwater fish, salted fish, pickled fish, and smoked fish accordingly. Still, again, proper sanitation and then avoid ingestion of raw, undercooked, or freshly pickled freshwater fish and shrimp. Okay, and so yes, please note that your Clonorchis sinensis infection is found in China, Japan, Korea, and yes, Southeast Asia. Okay, in Southeast Asia. But then there is actually one, okay, reported cases of opisthorchiasis in Davao accordingly. Okay, yes, that is for your Clonorchis sinensis. Tara, akit tayo. Akit tayo.